GNA Training Tips 2026 Geriatric Nursing Assistant Certification All You Need to Know Exam. Question 1. When washing your hands, you should stand so that you lean against the sink. Soap and faucets are easy to reach without touching the sink. Your hands are higher than your elbows. You can see the clock clearly. Proper hand washing involves avoiding contact with the sink surface. Question 2. Which of the following is considered a restraint alternative? Tying the person to a chair, using a bed alarm to alert staff if the person gets up, giving a sedative medication, locking the person's room. Restraint alternatives are measures used to avoid the use of physical or chemical restraints. Question 3. What should you do first if you tear a glove while performing a task? Keep working and change it later. Wipe the glove with alcohol, remove the gloves, perform hand hygiene, and put on a new pair. Put a second glove over the torn one. Standard precautions require immediate replacement of compromised PPE after hygiene. Question 4. Before applying a physical restraint, the person must be sedated, in good body alignment, asleep, tied to the bed rails. The person must be in a safe, comfortable, and properly aligned position. Question 5. When putting on PPE, gown, mask, gloves, which do you put on first? Gloves, mask, gown, goggles. The typical sequence is gown, mask, then gloves. Question 6. Which parts of a gown are considered contaminated after use? The back only, the gown front and sleeves, the inside of the gown, the neckties. The front and sleeves are the areas most likely to come into contact with the patient/environment. Question 7. If a male resident is rubbing his genital area, what is a likely medical cause? He is bored. He has a urinary tract infection, UTI. He is trying to get attention. He is hungry. Discomfort from a UTI often causes residents with cognitive issues to touch the affected area. Question 8. When drying your hands after washing, where should you start? At the forearms, at the fingertips, on the palms, between the fingers. You should dry from the cleanest area, fingertips, to the least clean, forearms. Question 9. What is a chemical restraint? A physical belt, a drug that makes a person sleepy and unable to function, a locked door, a warning sign. Chemical restraints are medications used to control behavior or restrict movement. Question 10. A resident who tends to wander should be known by only the charge nurse, only the GNA on duty, all center staff, only the family. Safety for wandering residents is a team-wide responsibility. Question 11. Which of the following can spread healthcare-associated infections? Hives, coughing and sneezing, only blood contact, only dirty needles, talking and laughing. Respiratory droplets and contact are major pathways for hives. Question 12. What is the safest way to use electrical equipment? Keep it near the sink. Ensure cords are frayed for flexibility. Keep work areas clean and dry. Use a 2-prong adapter for 3-prong plugs. Water and electricity are a dangerous combination. Question 13. If a visitor is threatening you at the nurse's station, what should you do first? Argue with them. Use the panic button if available. Tell them to go away. Hide under the desk. Safety protocols dictate using available emergency alerts in a threat. Question 14. Which action is correct when putting on a face mask? Cover only the mouth. Let the resident see your face first if possible to reduce fear. Touch the front of the mask while adjusting. Wear it around your neck when not in use. For residents with dementia, Seeing the caregiver's face before it's covered can reduce anxiety. Question 15. What is the danger of a restraint that is too loose? It won't work. It could cause strangulation or entrapment. It's too comfortable. It will cause skin rashes. Loose restraints are a major safety hazard for entrapment. Question 16. A flood warning is issued while you are at work. What should you do? Leave immediately. Call your family. Follow the center's disaster plan. Go to the roof. Employees must follow the established facility emergency protocols. Question 17. What does standard precautions mean? Only wearing gloves for sick patients, treating all blood and body fluids as if they are infectious, washing hands once a day, wearing a mask at all times. Standard precautions apply to all patients, regardless of diagnosis. Question 18. Which of the following helps prevent pressure ulcers? Keeping skin moist, turning the resident every 2 hours, restricting fluids, using a heating pad. Frequent repositioning is key to preventing pressure injury. Question 19. What is the normal range for an adult's resting pulse? 40 to 60 bpm, 60 to 100 bpm, 100 to 140 bpm, 30 to 50 bpm. 60 to 100 beats per minute is the standard adult range. Question 20. When a resident is dying, which sense is usually the last to go? Sight, taste, hearing, smell. Hearing is generally considered the last sense to be lost.